I was inspired by training up, I think we've trained nearly 700 doctors and dentists in coaching skills substantively over 3 or 4 days, and they quickly came back to us with, hang on a minute, Rebecca, it's not just with other professionals that we're using these skills, but with patients, and it's transforming the outcomes. So I went and looked around, and I ended up going to this wonderful course at Harvard, and in fact I confess I've been twice now, where I heard from talking to Margaret on the internet about, she said, come and see, and I found the funding and I got there. What I learnt was that lots was happening already, and I've taken it, came back, looked for people here doing it. I found Andrew, I found Penny, who had just done their nursing project, so here we are today. Then found a little pot of money from the NHS, and it was for GPs, so we trained up some GP registrars, and from there they learnt quickly to become coaches and coaching for health, and we also, with some of the money, trained up a cadre of doctors who, doctors and a pharmacist, Nina Barnett's here today, I'm pleased to say, who were able to train others in coaching for health. Another pot came my way. I'm great at jumping on bandwagons, by the way, especially if they've got a pound note attached to them. And we found that very cheaply we could train, and we've trained now 350 several different professions, not just doctors, together. And I even had a couple of secret shopper patients in there to make sure we were doing it properly and that they agreed that this was truly patient-centred. And so as well as that, we now have of the 700 trained, most of those trained substantively in coaching and mentoring. This is doctors of all specialities. They all, part of their basic training is also coaching for health. That had to be what I commissioned. We've also run tasters to all different specialities and abroad as well in Vienna, and we're soon going to Iceland. Andrew's going as our representative there, and we're going this year to Prague and Baltimore to show what we've been doing. So what we have is not a toolkit. Ours is about a quality service which we've aimed to use 3 different providers so that they could all learn from each other, and also the bit of competition is excellent always, I find, in life. So 3 different providers all basically teaching the same set of skills, not tools, which we use to teach all kinds of professionals to change behaviour in themselves, never mind the patient. It's a mindset change, and I know that's been overused, but it's about the patient being expert, it's about population health, it's about the clinician being a knowledge broker and facilitator. Sorry, that was not meant to happen, that's a phone call. From someone who's running population health, Sanjeev Ahluwalia, he's an excellent man. And as clinicians, we are knowledge brokers. We're not experts. We have to sit on our hands and not tell people what to do. As everyone said, there is real pushback if we do that. In particular, those with, thank you. And the other thing is we're to facilitate change. So what did we do? We ran 2 and 3 days so that we could see which worked better, and we decided the minimum was 2 days. Thank you. And the second thing we did is we ran tasters, and the other thing we did is we encouraged everyone who came on our courses to become ambassadors and roll it out locally. So who did we train? Mostly GPs, a few psychiatrists, dentists, a variety of people. Those who found it most useful were those GPs, obviously with chronic disease management, and myself, I use it for pain management, for weight, for any behavioural change. But more than that, it isn't a toolkit. I don't ever ask a patient anymore, how can I help you today? Because that is paternalistic and assuming I'm the expert. And we all know they are the expert of their own health. So what I find is that actually I've insisted for the last 3 years that all my practices allow me to do 15-minute appointments. My latest practice, I am proud to say, in Crouch End, sometimes gives me an hour. And people who were coming back and complaining and had notes that thick, you can spend an hour with them. They printed them off for me to read, so I threw that away for a start. and wanted to hear the patient's perspective, what she wanted change. And as far as I'm concerned, it's going to work. So what we've learnt is that patients love it, that the doctors who learn, 100% have recommended it to colleagues, and we have 89 on the waiting list. And I'd like you all to please embed it in the NHS. As a patient and as a doctor, it prevents burnout, it better results for the patients, so go for it and thank you.